Hello, everyone. This is Enrique Bakemeyer with Healthcare Business Insights, and I'd like to welcome you to today's sponsored webinar hosted by PMMC, Publishing Standard Charges, How Hospitals Can Control the Pricing Message. As noted on slide 2, you will have the opportunity to ask questions during the webinar by typing them in the space available provided in the open Q&A field on the right-hand side of the screen. We will take a couple of brief pauses to field questions on slides 16 and 29 and at the conclusion of the webinar. If you need assistance at any point during the webinar, please call our client engagement team at 888-700-5223 for personal attention. As always, today's program is being recorded, and registered attendees will receive a copy of the presentation by email within the next couple of days. Here are the learning objectives for today's session. Define how your current charges compare relative to the market. Explain how to adjust charges without impacting net revenue. Deploy online patient estimates to take control of the pricing message while also satisfying the CMS requirement. As a reminder, to receive CPE credits, you must answer the 3 in-webinar polls during this event. The first poll will be just in a few seconds on the next slide, and the other 2 will coincide with the Q&A breaks on slides 16 and 29. So before we turn it over to today's speakers, let's spend a minute on some HBI membership updates and also launch today's first poll. What is your confidence level in meeting the CMS price transparency mandate by January 1st? The answers are very confident, somewhat confident, or not confident. Again, that question is, what is your confidence level in meeting the CMS price transparency mandate by January 1st? Very confident, somewhat confident, or not confident. So first, a pretty significant update to our syndicated HBI content. We redesigned what had been monthly publications and have developed a new slate of products that are now being released weekly. In response to feedback from members like yourselves, we have created several pieces that are more focused, concise, and deliver the insights from our research in an easily digestible format. For example, we have an Ask HBI feature in which we collect frequently asked questions that we have received from members on a hot topic, such as even price transparency, today's webinar topic. But we've also done Ask HBIs on denial analysis, keeping up with payer requirements, and strengthening pre-authorization processes, to name a few. And we include the actual responses from our expert analysts in including relevant data when necessary. We also have a trending topic feature that provides an overview of a current industry issue along with quick hits from our analysts on the key takeaways from our research on that topic. We have a toolkit feature that collects resources we have developed on a particular subject matter area, so you don't have to start from scratch when working through a current industry challenge. And we're also developing infographics to highlight our growing sets of real-world data. So please have a look at our new featured research under the Research tab on the HBI web portal and let us know what you think. We're constantly looking for ways to evolve and improve our content to make it more actionable for you, our members, and we welcome your feedback. To be sure, we will continue to publish in-depth best practice reports, and in fact, we have a new mid-cycle governance report that is going to be uploaded in the next few days, but we hope you'll find value in these new pieces as well. I also wanted to note that since we've heard a lot from members on the CMS requirement to post charges online, in addition to today's session, we're also doing a roundtable on price transparency next week, Tuesday, October 30. That roundtable will feature additional peer perspectives, and you can register now under the Events tab on the HBI web portal. And with that, I'd like to turn the presentation over to our speakers for today, who will be Tara Bogart and Brad Josephson from PMMC, Danila Lubelzik from the Catholic Medical Center, and I believe Greg Kay from PMMC is also available to answer questions, and also Dan Teige from Impact Marketing will also chime in. At this time, if you folks would like to introduce yourselves, that would be great.
Hello, this is Tara Bogart, Vice President of Consulting at PMMC.
This is Brad Josephson, the Director of Marketing at PMMC. Hi, this is Donnella Lubelzik, Executive Director of Revenue Cycle at Catholic Medical Center in New Hampshire.
Hi, this is Dan Ty, Account Executive at Impact Branding and Design.
Very cool. Tara, do you want to take it away? I can go to the next slide for you.
Absolutely. Good afternoon, everyone. You're all probably aware of the pricing transparency rule that goes into effect on January 1, but did you know CMS recently released frequently asked questions pertaining to the rule? We're going to be covering these today, along with suggestions on how you should respond and get ahead of pricing transparency. The rule states all hospitals will be required to publish their standard list of prices online in a machine-readable format, and they must update the list of prices at least annually. This statement is somewhat generic and has left many with unanswered questions. One of the questions in the frequently asked questions document released by CMS relates to the format of the publication. CMS states the format is the hospital's choice as long as the information presents the hospital's current standard charges as reflected in its Chargemaster. CMS also made it clear in this document that the requirement to post charges applies to all items and services provided by the hospital. CMS further defined machine readable. It defined the format as a digitally accessible document that can be easily imported or read into a computer system such as Excel or CSV. It specifically says a PDF isn't acceptable. The last Q&A we were covering addressed hospitals that are already participating in a state online transparency initiative. It clarified that a state program does not exempt a hospital from this federal requirement. Enrique, will you go one more slide forward? Okay, and next I'm going to turn the presentation over to Brad to give you a little insight on what else CMS is up to that you might not be aware of.
Thanks, Tara. And I think that question about how you can provide additional price transparency is really telling, and here's why. So in addition to the FAQs, we've learned some more intel which may not yet be widely known. So CMS has released what they're calling a source sought notice, which really doesn't sound like much on the surface. But if you read into it, you will see that they are seeking vendors for a web-based platform to support healthcare pricing comparison and bidding activity. So this, combined with the CMS administrator's comments about price shopping, leads us to believe that CMS is plotting a move towards a retail-like model that allows patients to shop for healthcare services. We could be talking about the cars.com for healthcare. So it's really not hard to connect the dots here. While the only named requirement so far is publishing standard charges online, this really appears to be the first step, or just the tip of the iceberg, in CMS's long-term intentions for pushing price transparency. So this begs the question, how do you respond? We believe there are three different options, and we'll explore each one in the next hour. Option one is to simply export your CDM into a machine-readable format, such as a CSV or XML file, and post it on your website. You can do this yourself and simply just check the box, so to speak. But remember from the FAQs that CMS pointed out in the new price transparency rules that they do not restrict a hospital from posting quality information or additional price transparency information. In fact, the federal agency encouraged hospitals to provide consumer-friendly communication regarding hospital charges. So this brings us to options 2 and 3. Option 2 would be to post your full CDM and also post comparative market charges. We know that charges on their own really mean nothing to the patient. If you post this information on your website, you can start controlling the content and the ability for a consumer to view your MRI charges, for example, aligned with charges at other local hospitals, which may prevent inaccurate price comparisons. This at least helps you to start controlling that price message. The third option would be to post your full CDM and also provide patient estimates. We know that the patient portion versus the retail charges are often two very different numbers. An accurate estimate on your website that reflects the patient responsibility after the contractual discount and deductible will likely be much lower and provides actual value to patients. So we know that January 1st is the deadline to publish a list of standard prices in a machine-readable format, as CMS has outlined. There's no getting around that. But there are things you can be doing today to get ahead of pricing transparency. First, you should know how your commodity pricing compares to the market. For items that are often price shopped, will you be the high-cost provider? This is really important to know. You may not have time to change your prices before January 1st, or you might think you can only change prices once per year based on payer contract language. The price transparency rule states that you should update this information at least annually or more often as appropriate. So this means if you lower charges after January 1st, you can actually push the updates out at any time. So for hospitals who do not want to submit price changes to payers, a revenue-neutral Chargemaster adjustment is certainly an option and can help organizations focus on improving commodity pricing without a revenue impact. Danella will speak to this strategy more in just a few minutes. Taking control of the pricing message and allowing patients to determine their out-of-pocket costs through your hospital's website may not be a realistic goal for January 1st, but it can be a goal you can start working towards right away. I've outlined some ways to get ahead of pricing transparency, and Tara is now going to discuss the strategies and some things going on in the market in more detail.
Thanks, Brad. It's clear that CMS and consumers are pushing for transparency, but where do the payers fit in on the move toward pricing transparency? Well, as many of you know, hospitals haven't been real successful negotiating with their payers to keep the reimbursement neutral and lower charges. In fact, in the past month, I've heard of 2 scenarios where payers are entering a negotiation, letting the hospital know that they are having trouble promoting their hospitals because their discounts aren't significant enough. So a hospital that gives a payer, let's say 45% discount, now wants a 65% discount to give the perception that there's a deeper discount. As you can imagine, if the payer is pushing this on the hospital will need to increase charges to protect their revenue. This is counterintuitive to pricing transparency, but it does make sense. So as hospitals move away from large discounts, what is the real value to the payer? It will be interesting to see how payers are going to deal with pricing transparency in the market over the next year or two. So in the meantime, just be aware that this type of message from the payer may undermine your pricing transparency strategy. Is further proof that while charges are the focus today, hospitals need to get to patient estimates that reflect the true cost that they'll have to pay. So now we're going to take a break, and I'll turn it over to HBI for poll results and Q&A.
Thank you very much, Tara. Indeed, we will pause for our first scheduled Q&A break. First, we'll share the results of our first poll. As a reminder, that question was, what is your confidence level in meeting the CMS price transparency mandate by January 1st? The results were very confident, was said by 26%, 66% said somewhat confident, and 8% said not confident. And now, we'll launch our second poll. The question here is, what is your level of concern about how your standard charges will be perceived by the public? Your answers are very concerned, somewhat concerned, or not concerned. Again, that question was, what is your level of concern about how your standard charges will be perceived by the public? Very concerned, somewhat concerned, or not concerned at all. And with that, we'll begin some of the Q&A. Please remember, you can type in any questions you have in the Q&A panel on the right side. And we do have some pre-submitted questions that I'll pose to the panel here. And once I ask this question, I'll also unmute the other folks on the line so that you can feel free to chime in if you are able. One question we have here is, can standard charges be compliantly interpreted as the amounts generally paid by insurers, or does it have to be the Chargemaster prices?
Sure. Our opinion on that is that it needs to be the Chargemaster prices. Once the rule came back with the frequently asked questions, I think it clarified that gray area where many hospitals were wondering, as long as it was some type of standard charge, if that was acceptable, but it specifically calls out the Chargemaster.
Okay, terrific. There's a question about how marketing to patients, so maybe even Dan might be able to chime in on this one. How much do we have to advertise this to patients? Do we have to include a notice and a link on the homepage directing patients to the charges?
Yeah, this is Brad. I can take that, and Dan, if you want to add anything to that.
Sure.
So you are required to provide a link out to this, but we're going to talk in a little bit about how you present that pricing information, and we believe that there's a better way to provide accurate pricing information to patients, because as we know, standard charges really don't mean anything to them, because that's likely not what they're going to pay. So it is required. You do have to publish it, but we're going to give you some strategies for how to best present that going forward.
Alrighty, sounds good. And yeah, we're getting some good action here in the Q&A. Let's see here. Kate asks, when CMS cites all charges, does this require all supplies and drug prices to be reported as well? And if so, if there is not a unique charge code set up for each, how would you recommend publishing that information?
This is Tara. I'll take that. Yes, PMMC would recommend to err on the side of more versus less. That's a great question, and certainly one that we have heard. And many of the items are in the CDMs. Some are kind of hidden below, but yes, we would say be more all-inclusive if possible.
Okay, very good. And here was a question we got from Ross. Do published standard charges only require a description or revenue and CPT coding as well?
CMS has not clarified that. A typical CDM would have those fields on it, so I would probably recommend including those fields, but that has not been clarified by CMS.
All right, sounds good. What's the next question here? This one. All right, yeah. Beverly asks, what will people do about publishing supply and pharmacy items that are in the thousands of line items?
Well, again, as long as it's in machine readable format, I think that it's unlikely that patients are going to sift through a CDM file, but the importance is to really satisfy the requirement. We all know that this requirement is not going to necessarily help a patient price shop. It may help them a little bit, but it's not the perfect answer for it. So yeah, that's going to be one of the challenges. But the other thing you can do is to sort based on your usage of the charge codes. So some of the more common things would show up at the top. You could also do this for price shopped items, so that the things that kind of make sense to patients and consumers are at the top of the list.
Sounds good. Another pharmacy type question from Brad. With the requirement to post all pricing, how should we display pharmacy charge masters, since that department's charges are often set based on average wholesale price and can change regularly as the price for us changes?
CMS has not clarified that one either. I think an average may be what many are doing for those items. The other thing to note is that you can update this as frequently as appropriate. So if you're updating your cost file quarterly or annually, then those prices could be updated as well.
Okay, here we got a question from Dana. Are we only required to post only inpatient charges and data or all of our Chargemaster?
I believe that's all of the Chargemaster.
And Elizabeth asks, what if we have tiered pricing for inpatient versus outpatient?
I think in order to satisfy the requirement, if your true charges, I think that those should be listed as well.
Alrighty, Sandy asks, how do we handle items that are not in the CDM, such as miscellaneous charges?
Well, CMS's requirement only states that you have to publish the Chargemaster, so I think those can be excluded.
Sounds good. Do all charges need to be posted or just substantial volume charges? That's a question from Lisa.
I believe that's all charges.
Sounds good. Another question from Brad. Some services, like pharmacy, are not contained in the Chargemaster, but may reside in the pharmacy module. Do we have to go to other areas of the EHR?
CMS has not stated that as part of the requirement, so I believe if you just post the standard Chargemaster, that would be sufficient.
All right, sounds good. We'll take one more question at this point, and then we'll start moving on. Let me see here. Oh, here we go. Kate, if you have different pricing across regions, is the expectation to post charges for each region, or can you just use an average?
I don't think you can use an average. I think you need to be able to get down to the specific charge for a specific hospital.
Okay, sounds good. And we still have some more Q&A coming in, chat coming in. However, we'll take them at the next break. Although I do want to take a moment to ask, maybe Danella, since we've been, had a lot of questions coming in there. Do you have any thoughts on any of the questions we took just now?
No, not really. Just that, like Tara says, a lot hasn't been clarified with CMS. Just they continuously state it's your full Chargemaster, write down the CDM number, the description, and the dollar amount. There's really no guidance about the CPTs either.
All right, sounds good. All right, at this point, I will move along to the next portion, and then, again, continue to add your questions in the Q&A or in the chat feature, and we will take them at the next break. Thank you very much.
Okay, thanks, Enrique. Great questions, everyone. The pricing transparency rule addresses charges, not prices, and this may drive consumers to focus on an item that is irrelevant if taken at face value. So let's break down charges versus prices. CMS is requiring hospitals to publish charges, but this isn't helping patients know what it will actually cost them. I touched on that in the Q&A that just because something is published, it may be very difficult for the patients to drill down. Most patients do not understand that retail charges are almost never paid. They also do not understand the relationship among hospitals and payers and can't make the connection that charges are priced high so that the payers can receive the discounts. So let's look at a real example of a CT of the abdomen and how comparison of charges plays out. This example highlights conflicting material on the web, which is confusing for patients and can misrepresent the hospital. Based on charges, the medical center in this example looks over 30 times the price of the imaging center, and this could be your organization. But you have an opportunity to change the narrative. The patient's actual price is often not that significant if the insurance allowable, coinsurance, and copayment is taken into account. So when applying the insurance information specific to the patient, the price difference is actually under $100. So the key for hospitals is to start to change this narrative and meet patients online as they're researching and shopping. So on the timeline we reviewed in a prior slide, we discussed the importance of knowing how your prices compare, and this is something you can do prior to January 1. So with consumerism on the rise, you need to know what procedures or items you're getting calls or complaints about, what items are price shopped most frequently, who you're competing with, other hospitals or freestanding lab, radiology clinics, etc. And lastly, procedures or services where you might be losing volume due to your charges. CMS data has been used internally for hospitals for years to compare hospital charges. Why not repurpose the data to educate patients on charges at your hospital versus others? Showing charges at your hospital compared to the local market and statewide average charges better educates patients than just showing your CDM charges. The price shopping can stop at your website. With CMS data, you can post heavily price-shopped items such as MRIs and eliminate the need for patients to link data from various sources, risking an apples-to-orange comparison. If you don't feel good about your charges, you can change them. You don't have to wait until your next fiscal year. Many hospitals are changing prices without impacting revenue. The key is identifying and prioritizing your goals related to market, cost, gross and net revenue, and also understanding your patient mix and reimbursement to know how to best reach these goals. We recently worked with Catholic Medical Center to balance their goals through a Chargemaster adjustment project. This organization knows their commodity prices and how they look in the market. They were well prepared when they got the announcement for the transparency, and we are excited to have Donella share their approach to pricing. So Donella, how is CMC responding to the CMS ruling?
Thanks, Tara. Yes, we have been working with our New Hampshire Hospital Association. We had already collaborated with them on a pricing transparency project as well. So now we're all working together to standardize what we're posting online. Of course, there's only 26 hospitals in the little state of New Hampshire, but we're still, so we're able to work well together. We're going to make sure that we meet the requirement, but that we also are going to be clear and concise in the information and education that we're providing all of our consumers so that they're getting the same message, which is a lot to what Tara spoke about. You can post your charges, but again, patients, it may not come out to exactly what they're going to pay according to their copays and deductibles, like Tara gave the example of. So as always, it's best to have those conversations with patients face-to-face, if possible, to go through it with them. But since that's not always possible, we will be working to beef up our website to offer a way that patients can request an estimate online by putting in their own insurance information as well. But we did decide that, I used the analogy with Tara, that we're going to you're putting your house on the market, right? So you want to make sure it's clean and pretty, and when everyone comes over to see it, people want to buy your house. So we decided that we really needed to take a good hard look at our own Chargemaster ahead of time and get it all in order as best we could before we post it for everyone else to see. So last year we engaged PMMC and we only reviewed our hospital charges. This year we did a lot more work with it. We looked at all of our services, including our physician practices, all of our supplies, and our pharmacy. We had strategic goals that we wanted to meet, and PMMC was, we talked about those in the beginning with Tara, and she kept them at the forefront during all of the analysis and evaluation and work that we did together. We wanted to continue to be the low-cost, high-quality healthcare provider in the state of New Hampshire. We also wanted to make sure that we were within 95% of the market. So that was what was really great with PMMC, having that market data analysis that we could compare ourselves with any hospital in the area that we chose to. So we chose our local market, and were able to map out those scenarios with that data. We also wanted to remain net revenue neutral. That was very important for us. We wanted to make sure that our payers knew what we were doing. We were very transparent with them as well. And when we ended the project, we met with all the payers to go over it with them. And they were all very pleased with it, gave us good feedback on it, and were aware that other hospitals were trying to attempt to do the same thing as well. So our pharmacy director had also approached me and wanted to move away from average wholesale pricing for pharmaceuticals and use more of a market formula, more based off cost. And we also wanted to see what others were doing related to self-administered drugs, because that's a big controversial item if you charge for them or if you don't. So another good thing about PMNC was that Tara was able to give us a lot of feedback and information from other hospitals in the nation and what other people are doing and trends that she's seeing in the market for different things that we could trial. So it was really good feedback, and we were able to have weekly calls and go over all the different scenarios of things that we could do to remain net revenue neutral. And then we would get feedback from our internal team, our CFO, our Director of Budget and Reimbursement, and a lot of others, and finally in the end choose the best scenario for us from what Tara had developed for us. We also, it's important to note that we currently have PMMC's contract modeling software, so they already had our contracts, and it was we were able to take our volumes from last year's by CPT code to see what our high services were by volume with which payer, and also we internally knew which services were shopped most by our customers, and also what services we got complaints about for being high or outside the market. So we used all that analysis when we were making our decisions. And now we're going to take another short break to answer more questions and for Enrique to give us a status of the poll results.
Thank you very much, Janelle. Yes, we will. We'll pause at this time for our second scheduled Q&A break. But first, I'll share the results of our previous poll. As a reminder, that question was, what is your level of concern about how your standard charges will be perceived by the public? To that poll, we had 44% said very concerned, 48% said somewhat concerned, and 8% said not concerned. And now for our final in-webinar poll question. How are you planning to address the new CMS price transparency mandate by January 1st? Your options are post standard charges only, post standard charges along with additional pricing information, other, or don't know yet. Again, that question is, how are you planning to address the new CMS price transparency mandate by January 1st? Post standard charges only, post standard charges along with additional pricing information, other, or don't know. And we'll get right into the questions, again, on a very popular topic for today. Here's an interesting one. How can we use this information for market strategy now that we know what our competitors are charging?
So I think for the most part, organizations have been looking at comparative charge data for a number of years. As Tara mentioned, most organizations have been analyzing procedure-oriented charge data and then looking at how charges roll up to an average charge per case basis. I think this will just provide additional pricing transparency. It's no different than when you go to shop for a car. You can see what one car costs versus another. Doesn't necessarily mean you're going to compare what each wheel costs, but what you want to know is what the overall service is. I think the detailed information may be insightful, but I think the way it rolls up is really where CMS is going to be focused. And because all this gets turned into a discount or an expected reimbursement through the payer contract negotiation process, there will be some relevancy, but probably not significant.
All right, great. And since that was a marketing question, Dan, let me put you on the spot. Do you have any insights on that one?
No, that sounded pretty good to me.
Sounds good to me, too. All right, let's see what our next Q&A question is here. Carolyn asks, where can you find the information that was on the CMS side-by-side comparison slide?
Sure. That information is from CMS's standard analytical file. That's something that PMMC actually purchases from CMS, and we pulled that from that data. But that is publicly available data, and you can get the charges for any hospital. You can roll it up to statewide averages, national averages, things like that. If you want to send me an email on that, I'll be happy to share that with you.
Sure, and as a reminder, the contact info for all the presenters on this call will be on the final slide of the presentation, just for the audience's benefit there. Another question here from Paul. So if you include pricing from competing facilities on your website, are you not at risk if your report reflects an incorrect amount for that competing facility?
If you post those charges, if you get them from a source such as CMS's standard analytical file, you would just note where you pulled that file and what the time period is, and that should be accurate data.
Alrighty. Damien asks, does the CMS increased disclosure policy apply to private practices as well, or just hospitals?
I'm not sure I understand the question. Could you expand on it a little bit? Or maybe we'll come back to that one if someone wants to clarify.
Yeah, Damien, if you want to expand on that question, feel free to do it in the chat feature or to do it in the Q&A. So we'll look at another Q&A question now. Oops, wait, that's in the wrong panel. Excuse me just one moment. Here's the one from Mullick. What was your process, I think this is probably for Danella, what was your process to gather, document, and decipher patient pricing complaints?
From our customer service department and billing, most frequently called. But also there was a few areas in the hospital were a very large cardiac center, and we would often get directors calling and stating that they were getting a complaint about a certain cost compared to another hospital, so they wanted us to look at it. So we would those tend to all come to me, and I tend to keep track of them and go through and then work with Tara on seeing if we are indeed out of market, and if so, what are our opportunities.
Okay, very good. Here's a question from Dana that also seems to be maybe related to Damien's question too. Do we have to post our professional charges that do not live on the hospital Chargemaster but do live on the professional fee schedule?
The rule is for the hospital. So I do not think you have to post anything that's not on your hospital Chargemaster.
And then to clarify with Damien too, does that apply just to private practices if they're not hospital affiliated?
I don't think so.
No, it shouldn't be. We discussed that at our hospital association too. We all agree that it's just hospital charges. Okay,
sounds good. The question here from Lisa, our pharmacy Chargemaster comes from Horizon Medical Management. So I thought it's not contained in our standard Chargemaster. The HMM, so yes, this Horizon houses pharmacy charges. These charges cross over based on dosage. In this case, do prescription charges need to be posted?
I believe only the things in your hospital Chargemaster that live there are required with the transparency rule.
All right.
Enrique, I'll just add, I completely agree with Tara. That's what CMS's current statement is. I don't think anyone should be surprised if CMS does clarify later and ask for more detail and more pricing information. I think the direction and the path we're on is more is better than less. I think that's going to apply for the professional piece down the road. I think they were very clear that the initial request is going to be a hospital list of prices, but I think we should all be prepared for some of the questions that came up. The professional add-on components will probably be something that will be requested of you in the future.
All right, sounds good. Good to hear from you, Greg. And now we'll take one more at this break, and as a reminder, we'll have a final Q&A at the end of the session. But for now, we'll do one more, and there's a question from Brett, and that is, if drugs roll up into a procedure charge, do you only need to publish drug charges paid outside of the procedure charge?
I think I might need clarification on that one as well.
Yeah, it sounds like this is a question related to, if the drug charge is included in the procedure charge, do you have to just publish the charges for the procedures, or do you have to parse out other charges that may be included within a procedure charge? Do you have to itemize bundled charges?
I don't think so. It's your standard CDM, so that wouldn't, if it was bundled together, you would lose the standard portion of that. So I would say no to that.
Well, if you say no, then that sounds good. At that point, we will take a break now, and we will move on, or we'll take a break from the Q&A, and we'll continue on with the presentation. And Tara, or Brad, I believe that you're going to continue here on slide 30. But as a reminder for the audience, we will do a final Q&A at the end of the presentation.
All right, thanks, Enrique. So now that we've gone through how to properly adjust charges, we can start looking at how to best present this pricing information to the patient online. So we know that the digital expectations of consumers are changing rapidly. From our last webinar with HBI, we learned that there's a gap between online consumer expectations and what healthcare providers are offering today. So for example, 47% of consumers now expect personalized service online. However, we learned that only 7% of the attendees on our last webinar were currently offering personalized patient estimates. So that's an expectation that we as a healthcare industry need to start embracing. We also just learned how much patients are price shopping online today. United Healthcare just came out with their consumer sentiment survey, and they released that more than 1/3 of respondents, or about 36%, said that they have used the internet or mobile apps during the past year to compare the quality and cost of medical services. This really shouldn't come as a huge surprise, and it's up dramatically since 2012, when only 14% of patients were price shopping. But maybe the most impactful statistic is this: 1 in 10 patients said that they would actually switch healthcare providers after price shopping. So let's put this into perspective. Let's say you average 100,000 patients per year, and if we assume that 36% price shop, or about 36,000, 10% of those could end up going elsewhere. So you could potentially lose 3,600 patients annually to price shopping. This is the bottom line impact that we need to start taking seriously. So what do consumers want from their healthcare providers? Well, they used to just want to know, will I get better and how much will this cost? But now they want to know, how much will this cost me? Not only that, they want to know if this is a good deal, and that's why 36% are now price shopping. What am I going to pay for an MRI at your hospital versus the competition in your local market? And then finally, how do I get this information without a hassle? You only have about 8 seconds to capture the consumer's attention online. If you don't, they'll get frustrated and simply move on, potentially to a competitor. So how do you address this? Well, let's look at an example of how to meet these consumer demands. And keep in mind the points we just talked about and how this addresses those points. So first and foremost, we need to capture the patient's demographics. Notice the option here for the preferred method of contact. This is a very subtle option, but it puts the patient in control for how they want to be contacted, and it reinforces that point about personalization I made earlier. Next up is the patient's insurance information, which is going to be one of the key factors to producing an accurate estimate for that particular patient. We also have the ability to select a service and even compare multiple services. And personally, my favorite part of this example is that I can actually compare prices across different facilities. So I can choose the best price based on my location. Again, it's personalized for me. If I'm especially price conscious, I might choose to go a little further to save a little bit of money. So for any health systems on the call today, this is definitely a key consideration. In that estimate we looked at, notice that we were given an exact amount and not just a general price range. When we book flights or hotels, we don't want a range. We want to know the exact amount we're going to have to pay today. The same goes for healthcare. So it's important to remember the data points that drive the accuracy to arrive at that exact dollar amount. When you're providing estimates to patients, it's important to remember these 4 factors: the ability to select the right service, the ability to select the right location, selecting the right insurance coverage and benefit information, and then the ability to calculate the contractual allowable amount. So now I'm going to turn it over to Dan to expand a little bit on how we can best message around pricing.
Thanks, Brad. So on this slide here, I really want to focus on some key areas that you guys should be really focusing on from a digital marketing perspective. And, working across several types of industries over the past 5 years as digital marketers, I've seen some things, such as, industries are constantly changing. It requires businesses to constantly adapt. And this is specifically true for the healthcare industry, where regulations will come into play very quickly, making, you guys having to adapt faster and quicker. So, however, with these changes comes opportunities, and, how we can really capitalize on them. It's a simple question, but there's going to be a lot of answers on how we can do this, but we're not going to really know until we really test and try things and adapt. And it requires us to be very agile. So in my eyes, there's some 3 key areas we should be focusing on as we kind of address this big change here in the healthcare market. And that's messaging, the buyer's journey, and data and analytics. So when consumers are shopping, whether it's for a new car, a set of golf clubs, or healthcare, there are always key decision-making factors prior to purchase, and that's price. Price is one of them. It's probably one of the biggest factors we see. If someone is on your current or future pricing page, they're most likely very close to the point of purchase. No one just browses the prices of a knee surgery on the day-to-day. This means they're at this point in the journey where they're ready to make a decision, which allows us to really want to put extra emphasis on capturing this person as a conversion and an opportunity sale. And one way we can really do this through messaging is really building trust. And we can build trust simply on this pricing page through some key areas. And the first one, and I think Donnell made a very clear point about simply having clear messaging. And I want to elaborate on that a little bit. We don't want to try to hide anything from the consumer or try to trick them. Consumers are very smart, and they can get aggravated very easily if they can't find the information at the right time. So the more clear we are with our content and page structure, the more trust we will build with that consumer. Another key area where we can focus on is specifically on this pricing page as we build these out is on client testimonials or consumer testimonials that have worked with us in the past. Again, building that trust with other consumers who have, had services with these hospitals in the past, with a simple testimonial builds that proof of the consumer as they're evaluating these prices. Because if they're seeing more success with other consumers, they might, sway on some of the pricing a little bit. They might want to pay a little more for, as they see these testimonials with other people's successes working with them. Another big opportunity that we're going to highlight on this page also to build that trust is having a very informative ebook, highlighting some key case studies, or even a quick video testimonial, even quick, 1 to 5 minutes, maybe elaborating on some of these prices and how they should be evaluating these numbers can be really, really valuable to the consumer. And again, through messaging, we also want to get their questions answered, at the right time. As consumers start to browse these pricing models and comparing prices from different hospitals, having FAQs and those frequently asked questions answered earlier on in the buyer's journey can be extremely helpful to the consumer, creating less friction, getting answers quick, and they can make the decision quicker on their end. The second point here, as we address these new pricing pages is how we're going to drive people to these pages. I think there was a question previously in the chat of, how we should market these pages to consumers and how we should drive them to this page. And really, we really want to understand the buyer's journey from start to finish. Once someone lands on your homepage, how we want them to navigate to it. Is it the right approach to take them immediately to the pricing page? Maybe not, but at some point they're going to want to evaluate the prices, and it's going to be such a key page that, it might be extremely beneficial to have this in our navigation, or maybe in the footer, or maybe in the body content of your homepage. Displaying that key area is going to be really, really important. It's not something we want to hide from the consumer, because if they can't find it, they're going to find the information somewhere else. So it's going to, again, help them in their decision-making process. Another big opportunity also in the buyer's journey to help guide them through it from start to finish is implementing something around the lines of maybe a live chat. So on some of these high-impact pages, like your pricing page or your home page, or some of those steps prior to them getting to those price points, is often an opportunity to get in touch with someone quicker versus getting on the phone. So having a live chat where you can guide them to the next step, or guide them to the pricing page, and how to evaluate those prices could be extremely beneficial to the consumer. As we also, evaluate this buyer's journey, and we make sure we have very clear messaging, we're going to have to take an approach of how we're going to structure this information on the website, where we're going to place this information, how we want to drive consumers to it. And, the less assumptions we can make, the better. So we really want to empower ourselves through data analytics on our websites. And we want to do this, pre-launch of this pricing page and post-launch, because, we might not get it right the first time. We really want to take a look at some key metrics here. How many people are visiting this page? What are the bounce rates of this page? Bounce rates meaning how many people land this page and just jump right off because they don't find it helpful. If we launch this new pricing page and the bounce rates are 99%, meaning 99% of the visitors just bounce right off the website, we're going to want to address that and make sure we're providing the absolute best information that's going to capture these visitors and make them stay on the page and read about all these different services, and make sure they're just getting all the information at the right time. More key metrics could also be how long they're spending on the page. What are the conversion rates? So how many people viewed this page and actually became a sale? How can we close that gap from pricing to sale in really any way possible, whether it's, again, implementing live chat on this page. If someone's evaluating prices and they see a little chat bubble where they can ask a simple question about how they should understand this price, might be extremely beneficial. There's also other tools, maybe digital marketers might be familiar with this, but tools like Hotjar or a tool called Lucky Orange can help us better track our visitors and how they're engaging with our website. So we can utilize tools like heat maps on these pages to see where the biggest click points are, where the break points are on the page when people are bouncing off, what are the pages that people are going to after the pricing page, to help kind of close that gap, tying back to that buyer's journey. So really utilizing all the data we can, all the data we have, because, on a website now we have an influx of data, and it's really just being able to understand it and apply it to these pricing pages. And it's going to really help us improve our conversion rates. So pre and post launch, looking at the numbers, reviewing the data, maybe a month or maybe a week, 2 weeks, or a month out after we launch these pages to help better improve those numbers. It might take 2 or 3 times. When we develop and design websites here at Impact, we always say websites are never finished. They're always evolving. They're always changing. And especially, now where we have to meet these regulations and make changes to our website, it might take us 2 or 3 times to get it right and make these adjustments. So again, pay attention to the buyer's journey, pay attention to the data and analytics to make sure your teams are making the best and most educated decisions that are better for the consumer.
Thanks, Dan.
Yeah.
So keeping everything in mind that we've talked about today, how do you ultimately bring this all together with this January 1st deadline looming? And more importantly, how do you guide your patients to what's not only best for them, but what is best for your organization? So this is a very conceptual model of how you could potentially guide your patients and control that price message that we've been talking about. So let's start by looking at messaging. It's very simple. Know the cost of your health care. We mentioned here that CMS is requiring us to publish standard charges, but that doesn't accurately reflect what it will cost the patient out of pocket. So at the top of the page, which we call above the fold, we try to guide the patient to the most important information. Get your estimate now. If the patient chooses not to get an estimate now, that's okay. If they scroll down, they'll now see some more information about how your hospital compares to the local market, like Tara talked about earlier. This isn't the most relevant information for them, but it still educates them about charges and at least gives them some context. Notice, however, in that orange call to action button, we're still attempting to guide them toward an estimate. So now back to the CMS rule. We had a good question about what requirements are around advertising the standard charges. As far as we know, there aren't any requirements around advertising it. You just have to provide it. So we can still provide that list of standard charges that CMS requires, but notice how we've placed it at the bottom of the page. We really don't want patients to go here because it's not the most helpful or relevant information. Again, we're trying to guide them to get an estimate. So notice we've tried to guide the patient 3 to 4 different times toward the most relevant information, and we only linked to the list of standard charges once. As long as you link to the list of charges in a machine-readable format that CMS has outlined, you will have successfully met the requirement. The bottom line is you have to post standard charges no matter what. Everyone on this call will be doing this on or before January 1st. We just believe there is a better way to educate your patients, and we want you as the healthcare provider to control the pricing narrative and not CMS. So with that, I'll turn it back over to Enrique for any final questions.
Thank you very much, and thanks to all our presenters. We will do the final Q&A right now. First, the results of our final in-webinar poll. As a reminder, that question was, how are you planning to address the new CMS price transparency mandate by January 1st? 22% said standard charges only. 29% said standard charges and additional info. 6% said other, and 43% did not know. So with that, we will begin the final Q&A. Question here from Janine. If the charges that live in your Chargemaster for supplies and pharmaceuticals are shell codes, quote unquote, and not descriptive or all-encompassing, do those need to be posted?
If they live in your CDM, I would say yes. You need to publish the entire CDM. There's nothing in the rule that says it needs to really make sense, if you will. But to get the requirement, you need to post everything that is in there.
Okay, and this is a question from Elizabeth. It sounds like it may be for Danella. Did you use your Chargemaster descriptions, which are usually not meaningful to the patient, or did you convert it to layperson terminology?
I think she's asking to meet the requirement. Are we supposed to be using our Chargemaster descriptions? And I agree that they're not meaningful, but my knowledge, and Tara, I don't know if you know differently, but my understanding is it is the full Chargemaster, which includes the current description that's in the Chargemaster.
I agree with that, Danella.
Alrighty. Question here from Linda. Now, how we get paid, whether it be OPPS versus DRG versus MPFS, is not a deciding factor, correct?
That is correct.
Okay, that's a good one. We just have a few more, and as a reminder for folks that might have to jump off early, this is being recorded, and we will make the recording available to everyone who might be interested in the Q&A. Question here from Michelle. So does the new rule also apply to freestanding inpatient psychiatric hospitals?
The rule states that no hospitals are exempt.
Sounds like a rule. Lisa asks, isn't that the way it is with these rules? Lisa says, we have variable priced items where price is filled in based on cost plus markup. How do we handle these items to meet CMS's requirement?
Okay, so back to the pharmacy and supplies, those are the items that are typically cost plus markup. We've had a lot of questions on those today, and that's actually consistent with what I've been seeing over the past year with more hospitals coming to us to help with pharmacy pricing. So I definitely think that this is an area that pricing transparency is coming. In fact, this morning I read an article where CMS is looking to require drug companies to post those prices in TV ads. But that's a little aside, but my point is that pharmacy price transparency, I think, is absolutely coming fast. But for this requirement, I think just the shell codes, just whatever's in your CDM is what needs to go in. I understand that there's codes underneath that get marked up differently, but whatever is listed in your CDM today just needs to be posted.
Alrighty, it looks like we just have a couple more. One here from Lee says, what is the penalty if we don't do this?
I don't believe I've read this. I don't think it's been defined.
Well, surely there's some kind of a penalty. I guess we'll keep an eye out for that. And
but I wouldn't
finally,
want to find out. I'm sorry. I was gonna say,
yeah, exactly. Yeah, you don't want to find out, right? Exactly. And it looks like one last one here from Ross. Do specialized charge codes need to be published if the public will not obtain them, such as specialized contracting with a particular group?
I think if it's in your standard Chargemaster, if it resides in that file, that it should be published.
All right, sounds good. And with that, I'd just like to give my thanks again to Tara, Brad, Danella, Dan, Greg, and to all of the attendees today for today's sponsored webinar hosted by PMMC. That would be Publishing Standard Charges, How Hospitals Can Control the Pricing Message. Thanks again, everyone, and have a great rest of the week.